You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild. Hello, everyone. Welcome back to the Born Wild podcast. I'm one of your hosts, Sophia. Leah was planning on being here today, but she woke up with a very sore throat. Feels like she's swallowing glass. So she's taking care of herself at home. But today we have with us Dr. Rebecca, and I'm really excited to hear your whole journey. I heard your interview on the Midwifery Wisdom podcast and was like, I need to speak to this woman. So if you would just do an introduction to all of our listeners about who you are, and we'll dive in and hear about your journey.
Sure. My name's Rebecca Cohen, and I am a mother to 9 children. And I am a holistic women's healthcare practitioner. And I have been working with women for over 30 years now. So I started out in my teens studying herbal medicine and midwifery. Following that, I went to did a midwifery program at one of the birth centers on the Texas border. And then I went to medical school. I studied family medicine there and obstetrics. And then after that, birthed 5 children in 8 years.
Wow.
During that time through my residency and fellowship programs. And really through my own journey of looking for holistic healing for my body after those births, began to slow down and go back to my holistic roots, and started studying things like Mayan Abdominal Therapy and holistic pelvic care. And I traveled around to Belize and different places for my studies, and then had a began my holistic women's healthcare practice. That was in 2012, 2013. And then as my children got older, so I had 5, I adopted 4. And as they kind of got older and a couple of mine were able to drive, that was important logistically. Then I looked to returning to the birth world, and I apprenticed or assisted a midwife for a couple of years, and then began to do some further training. So I did the Free Birth Society's Radical Birth Keeping School and WAPIO's the Matrona program. And so now I am attending births outside of the system, which I know it sounds contradictory because I'm an MD, but in a way, because there's no regulations around MDs and what they can do at home births, it really is freeing compared to some of the midwives that are under regulations. And so even though I technically, am licensed by the state, I feel like in some ways I'm sort of an outside of the system insofar as I don't have any hospital affiliation. And and I'm attending births. And so
Just hearing all that, I'm like, how am I going to fit in every single question that I have? I feel like you've lived so many lives.
Yeah.
Okay, I think the first question that people are going to have in their mind is, where are you located? If you just sound like the person that they have to contact, where are you?
Yeah, I'm in Louisville, Kentucky. And so I serve women in Kentucky and Indiana and the surrounding areas like in person. I also do virtual consults. And so during that, there was about a 10-year period where I was not actively attending births. And so I was a doctor who worked with the CNM in the hospital. And so the majority of what I did was hospital births, although I did a few home births. So really, friends of mine, some of the midwives in the area, I attended their home births, but it was while I was working in the hospital system. So it was very much, on the DL. And then when I've returned now, I have no interest in sort of re-engaging in that. But so then the interim 10 years, I've had a holistic women's healthcare practice, which basically means anything that you would typically see an OB/GYN for, whether that's painful periods or painful sex, or you're trying to get pregnant, or you would like holistic support during your pregnancy, any of those things, menopause support, all of that, full spectrum kind of women care. So I've been having that as an out, in the office, but I also see people virtually for that. And I also do consults virtually for that. The other thing that I didn't mention is, like I said, I started studying herbalism in my teens, and I have an apothecary. So I have a whole line of herbal products that I make and that I've developed to support women, again, through for everything woman related. Yeah.
Great. And you sell those online, or is that
I
only
sell those
local?
online.
Yeah.
Yeah, I sell those online. And of course in person if you're nearby, but I definitely sell them online as well.
That's amazing. One of the first questions that popped into my head is, when you are attending these births out of the system, what do you bring with you? You have so many hats that you could place on. And so what does that include in like what you carry and like the services you can offer to someone?
Right. So, even before, like in the 10 years I took off from actively doing births, I was doing a lot of postpartum home visits then. So that was one of my I took Rochelle Garcia Saliga's innate postpartum course, which is so amazing, and
Mhm.
took that deep dive. And I was actually already seeing some women for postpartum in-home care before that, but that became sort of a bigger part of what I did. And I also did the Mayan Abdominal Therapy training for pregnancy. And so that was my way where I could kind of get my fix of being around pregnant and postpartum mamas, even though I wasn't actively attending births during that time. And that was mostly because, like I said, I had the 5 and then I adopted 4 more. So I had a house full of, 9 children. And so when I recently returned to doing births, that's been a huge journey for me, my birth bags. So I used to bring like 3 or 4 packed birth bags. And then now, kind of as I looked at it all, really every single thing has been a contemplation for me and consideration for me. And what does this represent for me? Yeah, for a while I was calling Pitocin my kryptonite because it's green and the bottle, and I was like, can I not bring Pitocin? If I bring Pitocin, where am I going to put it? Is it going to be in the car? So I really have to think about it before I get it. If a woman, and I have had women that are clear to me that they're not interested because of my, radical birth keeper training with the Free Birth Society, there's some women that are very clear they don't want me to bring any of that. And I don't bring any of that for them. But then the rest of it, like, what is my relationship with each and everything that's in my bag? And so, I bring a bag now. It's a bag.
Mhm.
And
Trim down.
yeah. And yeah, each thing I no longer, I carried oxygen. I mean, it was crazy, like what I carried. I carried things to intubate the mothers,
Wow.
as if,
Yeah. The just in
definitely,
case. Yeah. Mhm.
because I was able to intubate babies as well. I had baby laryngoscopes and, the whole gamut, and nasal cannulas for the mom and just so much stuff. And for a while, when I was first attending home births, I was with I attended some with a home birth midwife who was a CNM and a former Army midwife, and she had all this stuff. And at the time, I thought that was great. I thought that was really cool. That was like my ideal to like, she even had a stretcher that you could like pack down in the bag and bring out. Like,
Yeah. Yeah.
I was like, oh, that's great. You have all of it. And I did attend, like, also, she was really cool because she was a grain midwife. And so she was really into zero waste. And so we did cord burnings. And this was like 14, 15 years ago. So, a long time we did cord burn. So even though she had all of that stuff, she didn't use it necessarily. It was my first instrumentless birth was one that I attended with her. But since then, I really have, and it's a continual thing with me, like, I really feel like some of those things that you're bringing in, those are fears that that you're feeling bringing them in, and that if you are bringing in a stretcher for the mom and something to intubate her with, like, how much do you really trust birth?
Mhm.
And I think that may not be, true for everyone, but for myself, I found that as the deeper that my trust in birth has deepened, the less I feel like any of those things are appropriate at all to bring into a woman's birthing space, even if they just sit there and are never opened, like to even bring them in. So that's something I contemplate is the energetics of all of those things.
Is there anything that would be considered still medical that you do bring or leave in the car or anything? Or is it more doula support supplies?
I mean, I think so because I do have, gloves and
Mhm.
I don't always use them. Even
Maybe
the
like,
gloves.
do you carry oxygen? Like any like,
I don't carry
yeah,
oxygen.
left that all.
I do carry, it's a discussion I have with each of the moms,
Mm,
really. And so I
individual. Yeah.
individualize it out. So I do have Pitocin and Cytotec that I have.
Mhm.
It's a discussion, like I said, with the mom. Like I had one mom who was very clear that she really didn't want any of that. And she was clear, and I felt really comfortable under her direction. I didn't feel like that was something that I had to have or
Yeah.
had to bring with me. I really, at the 36, 37-week visit, bring over my bag and we look through it because I really want the mom to feel like that those are her things. Those are not my things that I'm bringing in. Those are her things. And which of them kind of does she want, if that makes sense? And so or not want, and there's still a lot of women that are like, whatever you think.
Yeah. We have those conversations prenatally too, that, the services we have to offer, whether it's blood pressure, things like that, it's what do you need to feel safe in your pregnancy and in your birth? And some people more things make them feel safer and other people less things make them feel safer. Um,
Exactly.
yeah, we
So
haven't had anybody that I remember ask us not to bring certain things, just that they would not want it, regardless, or only if it was life-saving. Personally, I've only given somebody Pitocin once in my whole career, so I take it like that it's if it's going to make the difference for us staying home and she wants that. But I think it's really overused.
Oh yeah.
Yeah.
Yeah. And
Yeah.
I have just I find myself, and in a way I consider myself a baby in this because I've really only sort of returned to it like within this last year, but every single thing, like every time even I enter a room and my presence alone, like each thing is an intervention,
Yeah.
and each word out of my mouth, and I'm not perfect. Like sometimes I still a recent birth I was at, I asked the mom if she had felt the baby move. And I don't know why. I was like, afterwards, I'm like, why did I even ask that?
Right.
Um, and it really had way more to do with me than the mom. And then afterwards, she apologized. She was like, I'm sorry. I couldn't answer you. And I was like, no, I'm sorry, I asked it, so I make mistakes. Like, I don't know, that was a huge mistake, but I make mistakes sometimes. I'm still learning, but it was like a whole contemplation for then after for me, like, what was it in me that felt like I needed to ask that of her in that time? And so I'm definitely still learning, but I've also, a good friend of mine who's a midwife quoted to me that I had told her in the past that, I didn't think I could ever attend a birth without Pitocin. And then she was like, and now I'm hearing what you're saying. And I was like, oh, I like, oh, okay, I said that. Like, and again, it's not that it's right or wrong at all, but I'm still feeling into that. And really what guides me is the mother each and every time. So making enough time prenatally and having those conversations prenatally so that when I come, we're comfortable enough with each other and I know what she, yeah, yeah, yeah.
And it sounds like you attend the births by yourself, or do you have like a partner or anything that you go to births with?
Yeah, so right now my sister is a midwifery student, and so yeah, it's super fun. And so she had been a doula for 10 years, and then she also took radical birth keeping school with Free Birth Society, and then is doing some further studying now. And so she comes sometimes. Really, I ask the mom, and I've had some moms, I've had a couple moms be like, just you, which is fine. It's just me. But typically they're like, by that time they know her too, because she works in my office with me. And so she often attends with me. Yeah.
And so do you do like the full prenatal care like a midwife would do? Or are people having more like wild pregnancies and you're going over for more connection?
Yeah, exactly. Yeah. So I, even before I was doing birth services, I had something called a holistic pregnancy program, and I still have that and do that, which is just a series of visits during the pregnancy. And so it really wildly varies, right? So I have women who are doing wild pregnancies and free birth that come and see me. Just to get the body, because I just give them body work and I teach them, how to do the Maya self-care themselves and, help them with whatever, if they're having back pain, how they can do support, postural stuff, all of that, herbal support throughout, just hearing, their fear of the day, and just so that they have someone to speak it to and it can go away, right? Or that type of thing. And so I have women who come for that. And then I have women who are like seeing the midwives, whether they're in town for a home birth or the hospital-based midwives, or I have some women who are not even necessarily interested in medicalized, I mean, in non-medicalized, that they're down for like their epidurals and they're seeing the typical OB, and but they just know that they can come spend time with me in my holistic pregnancy program, I think. Sometimes some of them want to know, like, what can I take besides Tums? Because all she told me was Tums and Zantac. And is there something else I can take? And so in that way, I'm there to offer them more holistic support. So I see sort of this wide gamut with that. But with my ladies that I'm seeing, yes, we do sort of typical care, which really varies from person to person again. So I have some women who we go over in the first couple of visits, like, this is what quote unquote typical westernized prenatal care looks like with the urine dip and the blood pressure. And this is why these things are done. This is what these tests are. And I have some that do not, are not interested in any of it. We don't like at all. And I have some that are interested in some of it, and it really varies. And some that, don't want to get any labs and don't want to do any of that, who are choosing me to come as a birth attendant. So that would almost be like more in a birth keeper role, if you will. I don't like to mince the, and then I have others who are seeing me that have had other home births with midwives before or whatever, and they're sort of like, well, why wouldn't you check my urine? Or, and it's just a lot of education.
Yeah.
Initially.
Yeah. I was wondering if there's ever any confusion, like that they are expecting more medicalized care because of your background, or if people are ever hesitant to hire you because of that. Like if you feel like it helps because they feel like getting the best of both worlds, and then do they feel confused if they're not getting more medicalized care, or just like, yeah, how that is because you like hold so many different hats.
Yeah, so I do like a general, like, let's meet Zoom with them. And then if it seems like that's pretty good, then we do like a 2-hour alignment session, it's called. And this is before we ever talk about contract or entering into care, or anything like that. And so I kind of straight up say, and then there's some people that I never see again after that alignment session, for whatever reason, which is fine. So we kind of start there, but even then, like, there's some who are like, yeah, it's just education. There's some who really know, like, I do not want, I've heard of that. I do not want that. And there's some that are like, I had that on my last couple of pregnancies, so why wouldn't you do that? And so then that's this whole other conversation. And then yeah, we go from there.
Mm-hmm. Beautiful. I know you touched on having 9 children, some adopted. Is there anything there that you want to share? Obviously, there's probably like not enough time to go into depth in all the births, but just anything in your births that obviously everything shapes you, but helped lead you to where you are today that you want to share?
Yeah, I think one of the interesting things, so is, I was in my residency with my first and my fellowship with my second. And I had a really beloved midwife who attended me at home, but I was going, post dates with both of them. And we were doing things like castor oil and stripping membranes and things because they couldn't keep me past 42 weeks. And at the time,
This is in Kentucky.
this is in Kentucky.
So
Hmm.
they have that law because we have that law here in California.
Actually, not anymore.
Okay.
So yeah. So yeah, it's a little bit, I was on the Cincinnati border. So technically my midwives were from Ohio.
Okay.
And so I think that was an Ohio thing, actually. And then Kentucky it was illegal until 2018. The legislature was passed, and then 2019, they are registered midwives here in Kentucky now.
Okay.
So, but I was, even though I was into, natural birth, or I knew I wanted to have my babies at home and all of that, I didn't realize that there was even a possibility. So I sort of subjected myself to that. It was also self-imposed, because I didn't question any of that, despite the fact that my mom told me when she had us and my siblings and I in the 60s and 70s, she was like, oh, I always went 2-3 weeks past my due date. That's just what I did, And so, yeah, so it was difficult for me learning about physiologic birth, which really didn't take place, even though I was kind of considered the natural birth doctor in the hospital or whatever. Like, really understanding what physiologic birth was and then learning about that more recently in the last couple years. It's been a lot of grief and unpacking for me about those births, and to see how much was just, the vaginal exams that were not necessary, but I thought they were. And so I was totally fine with her doing them at the time because that's what I did. And even my midwifery training in the birthing center was very hands-on, hands-in. Like, and so this was, yeah. And to just sort of wonder and further, not even just wonder, but kind of really know what it could have been like had I been left more undisturbed, or had I realized, or
Yeah.
Yeah.
Everything's affected. Yeah, you have such like a wide list of programs you've attended that are all like
Mhm.
amazing programs. Was there one that you felt made the biggest shift in the direction of your career, or had that already happened prior to programs, or one that just really stood out as like this pivotal moment for you?
Yeah, there's two in particular. So the first one was so I was pregnant, nursing, or both for 11 years straight, right? Just had my kids one after another. And so I had read Wild Feminine by Tammy Lynn Kent and was interested in holistic pelvic care. That blew me away. I'd gone to a conference that she had spoken and like was completely riveted by, because those were things that all I knew were surgery for, for prolapse and for urinary incontinence medicines and surgery. And so I had pretty bad prolapse at the time, mainly because I did not take care of myself well postpartum at all. Um, did not know how to attend, like, well, yeah. And it's the same advice that I did not give others, which is like you say goodbye and then you see them in 6 weeks. And like, and then when they're at 6 weeks, you tell them they're okay for sex and exercise, but know like really how to take care of yourself postpartum. And because of that, I had developed prolapse pretty bad. And I was signed up for, a hysterectomy at 36 or whatever I was. And I was trying to decide the timing of my hysterectomy with regards to going to this training and when my kids were going to be in school and all of that. And I went to the training and really realized on the second day of the training that I was not going to need a hysterectomy once I learned, holistic pelvic care. And then, so that was super pivotal. I remember exactly where I was in the hallway, the whole thing. And I had been doing the practice sessions with my right hand, which I now see as like, I consider it like my more medical.
Yeah.
And Tammy suggested I switch to my left hand. And so it became this intuitive, energetic work within the pelvis.
Versus
And
your like diagnostic hand.
yeah, yeah. And so I realized two things. Like, first of all, I wasn't going to need the surgery, which has panned out. Like now, almost 15 years later, still have not needed that and work to heal the prolapse and all. But also that I was going to change my office, like that I was going to change and do this more holistic work. And so that was one where I really had the big lightning aha moment. And then the other one was a couple of years ago now when I did the Free Birth Society, like the Radical Birth Keeping School, and I really took that deep dive into physiologic birth and that deep dive into what it means. I was still at that point using phrases like, shared decision making, which I thought was great. I thought I was open minded because I said shared decision making. Not, and so the
Because you
radical birth.
were letting them make decisions too, in air quotes
Exactly.
for those who couldn't.
And man, the like, yeah, just being called out, which I'm grateful I was called out, like, um, by, Emily and Yolanda, like called out in a loving way. I have to say it was called out in a loving way, but called out like, yeah, no, it's not shared decision making. It's the woman's. And oh, just that was a huge reframe for me. And
Well, and the reason I feel like we even have that is because there is this like liability piece for the birth worker, midwife, OB, where it's like, regardless of what the parents feel, the state holds you accountable, even if they're happy and all, so I think that's where people tried to settle on something. It's like, well, I'm still potentially losing my license or going to jail over the decisions we make together. So I want to be included, like I think that's where it comes from. And so it makes sense. And it really shouldn't be up to us.
yeah, and it there's a lot, there's a full third of the course is what's called self-mastery, but that being super clear about being clear about your words, being authentic in your actions, all of that. And I felt like that was what was a big kick for me to be like, okay, I'm ready to return to birth work, and I'm ready to return to birth work in this way. So that was like my second like big pivotal like return to birth work course.
Leah and I both did the Radical Birth Keeper School. I did the first course, and I was blown away by the self-mastery course because I didn't really know what to expect going into it, and that was the best piece in it for me.
It was great. Yeah.
Yeah. I have a question around, so Kentucky used to be illegal, now it's legal, there's licensure that you're not beholden to.
No, because I'm an MD, and so that's for the midwives.
Mhm.
And
So like here, our licensure, the biggest pieces of it are in 2014, we became autonomous providers. We don't need physician supervision, which we were all yay for, but they took away breech twins and are only allowing us to attend births between 37 and 42 weeks. And you like, do you support those types of births? What are your opinions on those types of births being performed at home? Do you touch on those?
yeah, I do support those type of births. And actually, yeah, it's funny you said that. I just got an inquiry from a woman today whose baby's breech, and her midwife, will not attend her because her baby's potentially going to be breech. And
So does licensure there
yes,
restricted
so
of
I am
those
not
things?
an expert on the Kentucky licensure, but this one is actually from Indiana. But and I really don't know anything about Indiana's. From my understanding of Kentucky licensure, that we got one of the better licensure things, because it doesn't specifically forbid anything. It just says that you have to have informed refusal or informed consent or informed something, a document. But basically, you can put whatever the thing is in there, whether it's postdates or breech or whatever. And then the woman can sign, and then that's it, which is where there's not this cut or dried. So
I would love that.
yeah, I think it's way better here. Again, like I don't have to deal with those papers, so I don't see that. But I will tell you that a lot of midwives in Kentucky do both twins and breeches regularly. That some of the midwives I know here do them regularly. So that is, yeah, that's pretty great too, to also have midwives that have had experience,
Yeah,
you know,
not losing those
in
skills.
my vicinity with those as well. And so, yeah, recently with one of the midwives here, she asked me to come along as another, just to be there. That's actually happened a couple times. Somebody who had twins, somebody who had breeches, and or a woman with breech. And I feel really grateful that I can potentially, if I feel like it, or if the mother is open ultimately and would like someone else there, that there might be someone else there. And again, like that always goes back to the mom. I just keep like reorienting again and again to the mother in any of that. But
Are there any types of breech or types of twins that you wouldn't feel comfortable attending at home? Like, do you have your own personal restrictions there?
no, not right now. Yeah. Mm-hmm.
And what about post dates in terms of like how long there's this thing where, because so many people are either induced or are doing these, in air quotes, natural induction techniques out of fear of being risked out of a home birth, we almost don't know like what the normal is and how long people go. And even people who, like you, are saying, my mom and grandma went, I'm going to, as soon as they pass that marker, they realize how much fear there is. And like, do we do extra ultrasounds to check on the baby and fluid levels? Like, how do you support women who are going through this, and families saying how dangerous it is? And it's just, it can get really messy.
All the things. Yeah, totally. I just recently had somebody who did that. And I thought it was really interesting. So their first one, their first baby, they were seeing like a doctor in a hospital, and he had told them, at 42 weeks, she had to be induced. And I remember when they were telling me their story of their first pregnancy, and they said, they got induced on a Sunday. And I was like, how did you get induced on a Sunday in the hospital? I've never heard of that. And the dad was like, oh, we fought. They were saying come in Friday, but we were like, no, she's not 42 until Sunday. And so we're not coming in until Sunday. Right. And so this time around, she went, and then 41 weeks came and went, and then 42 weeks was and it was so interesting. I mean, I was over there a lot, talking with them a lot, let them know about NSTs and BVPs and that those were available to see, what, and we talked really on an almost day by day, if not every other day basis. Furthermore, her waters opened like it was days, and continuing with this. And it was really, really interesting, because they hadn't even quite hit 42 yet, but there was a lot of like, should we do that? And the first time they said their doctor wanted them to come in for all these BPPs, and they refused. And then this time they were considering, well, should we be doing this? Should we be doing that? And they also felt like they couldn't no longer go out in public. Like they couldn't go out in church. They couldn't even go out like in their place because everybody was asking them so much. And so I posited the question. I asked the question, like, so it really seems like you're considering some of these other interventions this time, whereas last time it was a no. And what the dad said to me was, last time I was fighting tooth or nail because they were telling me that I had to be doing this. And he goes, and this time you're like, well, here it is. What do you want to do? And he's like, and it's all on, us. And so I don't know. And I thought that was so interesting. It was really, really
When they're
interesting.
faced with like, this is my responsibility,
Mhm.
versus it's somebody else's responsibility. Yeah.
Yeah. And he said, last time we were just gearing for a fight. Like we were gearing for a fight. We felt like we had to fight. And he goes, and this time we don't have to fight you. So this is way harder.
Mhm.
So it was really interesting, and really just fabulous, and such a blessing working with them. And yeah.
Yeah. What is the latest you personally have seen women give birth?
So personally, like 42 and 2,
Mhm.
um, I've certainly not personally, but heard a lot longer
Yeah.
from others. Yeah.
Yeah. Yeah.
Mhm.
Um, yeah, that's interesting. We've definitely heard, like, we know of somebody who was an IVF pregnancy. So, because like sometimes you're
So that
like,
you know
well, are the
exactly,
dates
right?
right? Like there's always that question. But for sure dates. And she went to 45 weeks. At 30, I want to say 43, she started going to the hospital for non-stress tests every 3 days and left. Like how strong you have to be able to walk back out of the hospital when everyone's like, stay, you need to stay.
And
And she did end up having a C-section at 45 weeks, but all the non-stress tests were always normal and fine. And she says now, like, if I have another baby, I'm just gonna keep going. See when this baby wants to come. But
wow, yeah. And I've certainly heard many, many stories. I'm still in the, Free Birth Society membership, and there's so many stories of that. But yeah, personally with women I've attended, that's been it so far. And each one, I feel like each woman I work with is just so much, yeah, so much medicine, I feel like, with each one, and so much learning each time. And there's just not, it's never going to be the same. It always depends on the woman and the baby and their journey. And yeah, really just an honor to witness. And
yeah, yeah, beautiful. Um, I did want to talk about, I don't know if this is a thing for you, but there are a lot of conversations with midwives and in regards to licensure, and if you are, maybe supporting families in a genuine way to you that steps outside licensure or is in gray areas. Do you ever feel the need to like protect yourself? Is there ever that piece in terms of contracts or, just anything like that? Do you feel always safe? Is there ever this piece of like, danger for you, whether for your licensure or your, just personally? Do you ever feel unsafe?
I have not yet. There was one that during pregnancy, I just felt like I'm not sure that the trust was there, but mutually, And so honestly, as soon as I started feeling that, I let her know that I was not the provider for her. Which is challenging because we want to be there for everyone, right? And there is still, that's all that heroing and all, all of that stepping back. And so and there may be, again, like insofar as this new reiteration of Rebecca, we're just coming up on a year. Like it's not been that long. So ask me in
Yeah.
10 years, you can have me back on and I can, we'll see what I tell you then. But so far not. And I really, I take a long time in my prenatals and we do not beat around the bush about like what it means to take, radical responsibility and sovereignty. And we talk about what would that look like if the baby died, and we talk about that and feel that out. And I take my direction from the women. It's just it's interesting, and it's each and every woman so far has been different. Yeah. Mm-hmm.
I asked this question because we have such a variety of people who listen, whether they're parents, families, birth workers, junkies, as some call themselves. But this is for more like the birth workers, and you don't have to get into details about price, but I'm curious about like, do you do contracts? Do you like, they're hiring you as an MD? Are you covered under insurance? Like curious just about like the financials piece and like what that looks like for you.
I do contract, and really I work, I do contract, and some of the local midwives here were very helpful with me with like kind of helping them see their contract and their contracts and what that looked like. And I went back and forth about that, honestly. But I do. And the other thing is, I do not carry malpractice. I dropped malpractice years ago. So I dropped malpractice really when COVID happened and things were all shut down, and I was really going to have to. Actually, I think it was honestly before that. My malpractice is so high I can only imagine if I had malpractice for birth, what that would look like. But it was already so high that for me to see, typically my office appointments are an hour. They're 2 hours initial and 1 hour for follow-up for, if you're just coming in for a well woman care or whatever. And my prenatals are typically, like 90 minutes long each time and all that. And so, whereas when I used to practice in the more typical medical model, I saw between 20 and 25 a day, right? And in order to pay malpractice, I wasn't, I mean, there were certainly years when I did my holistic practice when I was carrying malpractice that I was making like $15,000 salary for like, and so either you have to work and see a ton of people or not. But the other thing, when I looked at it again, because I considered it again, I pondered it, returning to birth work. And to have malpractice, you have to have requirement of the malpractice company is to have a agreement with the physician that's in the hospital, or agreement with the hospital to take your patients, like, right, your patients. And so that meant I would potentially have to be beholden to someone at the hospital, to what I was or wasn't doing, and I just am not, I just says that was a big enough reason for me. And even if it wasn't the financial piece, but that then hooked me into the system. Like, and so that is a huge, when you talked about, the understanding of, wait, you're an MD, this or that, we have all those conversations in the alignment sessions. So that means that I'm not affiliated with any hospital. That means I can't call and get you in if you're anywhere. Like, I can't do that. And I don't carry malpractice. And so that, I let them know that to begin with, but really that was in a way how to separate myself from the system. Yeah.
Yeah. What a blessing you are for the families in your area, and of course virtually too, but it would be amazing if we could find a gem like you in our area. Yeah. It was so great speaking with you. Is there anything you feel like we didn't quite touch on that you really wanted to leave with the listeners? I know we could go into so many details about like the pelvic floor health, like that really piqued my interest too, about prolapses and things like that.
Yeah, I just recently put together a course called Your Postpartum Pelvis
Hmm.
that is all about how to take care of your body after birth. So everything from when to return to exercise, to nutrition, to how to take care of healing tears and prolapse naturally, and guidelines for all of that, because it's a huge, huge love of mine. And that's really, I really went sort of deep into that work, that kind of decade that I had off from doing birth work. And so, and because of how, even though I was considered a birth expert and an OB and everything at the time, like how I didn't know how to take care of my own body after birth, and how unfortunately for all those women that I served during that time, was not able to give that to them. And so I started teaching this course a couple of years ago in person called Root Care Workshop, like how to take care of the root of your body after birth, and had a lot of birth workers and midwives and midwife students and postpartum doulas and all of that come and take that in person. But I recently kind of got it up to where it's an online course now, and that's a huge heart project for me, because it's it's so important.
Is it more
And
for birth workers or for parents?
moms, it's for both. It's for birth workers and for moms. So a lot of women, and in particular, I did it in conjunction with or it's on the platform of the Free Birth Society. So a lot of those women, like, what do you do, and what is normal for tearing or not tearing, or how to take care of that. And same with pelvic floor, and how do I know if I have a prolapse, those kind of things that you hopefully want to be able to take care of on your own.
Okay,
And
I
so
thought of my last question. Tearing.
uh-huh.
Do you suture? Do you see third degrees? What are your thoughts on those?
Yeah. So far I've not seen, honestly, I went through this myself too, because I had all the stuff in my previous birth kit, like the multiple things to do those like third and fourth degrees. And now, honestly, if you tour that far, I think it's best that you go in to where they're going to have the lights and the all of that. So at some point in time, I realized, like, that's probably not something. Well, I don't know. I'm never going to say never. Some women may say, no, I
We
absolutely don't
recently
want to.
had someone with a third degree decline any suturing and stayed
Yeah.
home and healed beautifully. That was our first experience. And it was like the perfect third degree, like it looked.
Yeah, exactly. So, no, I have not. I do have the capability to suture, but I really go into that actually in my course. So just because people do sutures doesn't mean, or have received sutures doesn't mean that they needed sutures. And so I have not sutured anyone who has been with me so far. It's just not, and I have seen tears that I definitely would have sutured in the past,
Right.
and they heal. They heal. And so
Obviously people can take the course if they want more details, but like, do you carry supplies for healing naturally? Do you recommend people get them ahead of time, like in terms of manuka honey or seaweeds or things like that? Or is it more about rest? And because like some people, we don't necessarily have them gather supplies because we assume even if you tear, you're just going to heal on your own. But every once in a while, somebody wants to do something and then they're postpartum trying to like gather all the supplies. It's a little tricky.
yeah, I don't. And honestly, like, and I know some women that have really loved like the seaweed and manuka honey and all of that. That's a little bit extra. I feel to me like that's a little bit extra. I feel like mostly like the big things are letting the swelling happen. Like there's this thing, you're going to put ice down there and make the swelling go down, but the swelling actually keeps it together
So
initially.
interesting. I've never heard it phrased that way.
Yeah. So letting the swelling happen, and then honestly, like keeping off your feet and letting those tissues, that lattice work, really come back together. So it's mostly that, and steams can be really great. And I do, bring this stuff and help facilitate postpartum steams and have the herbs for that. The steams and the peribottle, the herbs are just absolutely wonderful, whether it's a peribottle, a sitz bath, or a steam. There's so many healing herbs. And so I do make a postpartum herbal blend that I give to my moms. And yeah.
Oh my gosh. Well, thank you so much for all this information. I have so many notes. I had to use a couple of pieces of paper. If anyone wants to reach out to you, which I'm sure they do, how do they reach you?
Yeah, so my website's fullcirclelouisville.com. So that's LOUISVILLE.com. I'm on Insta at Full Circle Holistic. Yeah, and my course, you can either come see on my website to find out more information about that. I have it's not quite up there yet, but it's going to be within the next couple weeks. I have a full free, like 20+ page ebook that's a short little, compared to my course, it's short. I think it's kind of big for an ebook, but that's going to be up there as the freebie. We're working on like getting that together as a freebie right now. And then I have some steaming like ebooks and things like that are already on there if people want to check out free resources as well. And then I do offer those let's meets if anybody just wants to talk for a little bit and see if we're a good fit for moving forward. So.
And I heard you do virtual consults. Is that for either families or birth workers?
Yes, all of it. Yes. And it doesn't officially, that's funny you say that. It doesn't officially say for birth workers, but I've definitely had birth workers reach out, and I haven't like codified that on my page, but same thing. And yeah, happy to.
Okay, beautiful. Well, thank you again so much.
Right. It was a pleasure. Thanks.
Okay, everyone, that's it for today. Thank you for listening to the Born Wild podcast. If you enjoy our podcast, please rate, review, and subscribe every week to get the latest one.
And please follow us on Instagram at Born Wild Podcast, as well as Facebook. You can also write to us at info@bornwildmidwifery.com, as well as our website, bornwildmidwifery.com.
And remember,
Stay wild.